Hi everyone, it's Lenore Khoubesserian with the Medicare Authority, and this is 7 questions you need to ask before going on Medicare. This is the first video of our 7-part series, and in this video we're going to talk about what is Medicare, who it's for, how Medicare is different from your employer plan, and what's the difference between Medicare and Medicaid. If you haven't already done so, you can download a copy of our free report in the description below, so you can follow along. We welcome you to like, subscribe, and comment below. Okay, so let's get started. Question 1 is, what is Medicare? Very simply, Medicare is health insurance for people 65 and older, and for certain folks under 65 disabled, those folks with end-stage renal or certain disabilities. So Medicare has been in place since 1965. It's a little bit different than the way we're used to having insurance. It's different from the employer plan because it's for the individual only. Unlike your employer plan, you can typically add your spouse, your significant other, or your children. Medicare is for you only. Also, Medicare, since it's been in place since 1965, is broken up into parts. Part A is your hospital coverage, B is your medical, D, like drugs, is your prescription or drug coverage. The employer plan, on the other hand, has everything bundled into one. Medicare is broken into parts. Additionally, with Medicare is going to pay 80% of your claim, and you're going to be responsible for 20%. Okay, we're used to having everything under one plan and having deductibles, co-pays, and co-insurance. So one major difference between Medicare and your employer plan is that Medicare is an indemnity plan. So it's going to pay 80% of the bill, and you're going to be responsible for 20%. The employer plan, on the other hand, typically will have like a simple copay to see a doctor or a specialist, and may have a deductible. Also, as an out-of-pocket maximum, Medicare doesn't have that. So another big question we have is Medicare and Medicaid. They sound alike, people get them confused, but there's a big difference between the two. Medicare, again, is health insurance for 65 and over, under 65 disabled. Medicaid, on the other hand, is public assistance. It's health care for low-income Americans regardless of age. Qualifications for Medicaid are based on your income and your assets. Medicare, on the other hand, is based on your age and your work credits. So to be eligible for Medicare, you typically have to have 10 years of work credits and be 65 or over. Now, it is possible to have both Medicare and Medicaid together, and we're going to talk about that a little bit more in the 7-part series, but Medicare and Medicaid are two distinct different options. All right, so if you need to get in touch with us, here's my contact information. You can find me on Facebook at Lenore Khoubesserian, or you can check out our website or Google page, the Medicare Authority. Please like, share. You can set an appointment with me by going to medicarebylenore.com.